Well, I just got back from Edmonton. I spent 2 days there taking food safe courses. I was working on my food safety level 2, which allows me to operate as a manager of food service establishments in Alberta and in BC. And part of that course is I got to spend 2 full days with a health officer who was instructing the course. And it was kind of interesting, as it turned out that both of us had spent 30 years in our respective careers. One thing I did learn was that all public health officers are accountable and are under scrutiny for all of their actions. And this works both ways. They are also accountable for any reports that they have to follow in with an investigation. So if, for instance, in our case here in Belbutte, a doctor had filed an NDR, which is a noticeable disease report, under the law, a public health officer would be required to conduct an enteric investigation. And that investigation could have led to an inspection of the Belbutte community. At the public meeting in the Belbutte Hall, when questioned, Peter Ross stated that there had been no NDRs from Belbutte at that time, and that the proposed inspection of the Belbutte community was not an enteric investigation. Another reason that a health officer could request an inspection of private property is if there's been a complaint of a health hazard. The public health officer, under law, must investigate. Our instructor gave us a story about an investigation she carried out, which would have fit the kind of investigation that the public health region is trying to do here in the Belbutte community. What happens was that there was a complaint in an apartment that there were cockroaches in the building. And so the public health officer went out to the apartment and investigated, and yes, there was cockroaches there. Now the thing is, in order to control those cockroaches, you have to be able to see where they go. So you have to carry your investigation further. So you have to go up the plumbing, above, down the plumbing, below, through this wall and through the other wall. So you have to carry on an investigation throughout the infested area. So they requested to investigate all the apartments around where the cockroach infestation had been found. And one old lady downstairs simply would not let them in. And so after a lot of trying, eventually the health officer went and got an order from the court, a warrant, and to be able to go into that apartment and investigate to whether the cockroach infestation had actually spread to that apartment, so that they could bring in the proper pest control people to control it. The point is, that same public health officer could not just walk down a street and look at an old building and say, hey, you know, that's an old building. I bet you it's full of cockroaches. That public health officer could not, without a complaint, simply go in and start an investigation for cockroaches just because they believed there might be cockroaches there. We do not have that right under the law. A public health officer has full rights to enter and enforce Public Health Act regulations in a restaurant or a public water or sewage system that operates under permit from the Public Health Department. And that's the situation I've worked in all of my working life for 30 years. And we understand that permit on the wall allows us to carry on our business. It also allows that health inspector to come in at any time during our working hours and inspect the building. And we cannot say, no, you can't come in. But no health officer can issue an order to initiate an investigation onto private property without first establishing a full legal justification for that investigation, which under the Canadian Charter of Rights and Freedoms is called fundamental justice. The Canadian Bill of Rights, an Act of Parliament, defines those rights as A, the right of the individual to life, liberty, security of the person, and enjoyment of property, and the right not to be deprived thereof except by due process of the law. And B, the right of the individual to equality before the law and the protection of the law. As I said before, health officers must be held accountable for all of their actions. At this time, the Belbutte community is dealing with 3 orders from Peter Ross that we believe Peter Ross should be held accountable for. First, a registered letter from Peter Ross ordering Lloyd Johnson to shut off his neighbor John French's sewer. The question, does Peter Ross have the legal right to give this order? Second, there was a letter hand-delivered to Mr. and Mrs. Agri dated April 23rd, which was entitled, "Regarding Non-Conforming Method of Sewage Disposal," which declares that the non-conforming system a health hazard and orders it to be immediately disconnected. The question is, does Section 46(2), the notwithstanding clause, apply in this case? And did Peter Ross have the legal right to give this order? The third thing, the letter sent to most of the residents of Belbutte, dated May 26, 2008, entitled, "Regarding Request for Access for the Purpose of Inspection," which states, "The access to your property, not within the dwelling, is hereby requested for the purpose of inspection in accordance to Section 53, 1 and 4 of the Public Health Act, 1994, and goes on to state, the purpose of this survey is to determine if a health hazard exists in your community. Information from this survey will be used to determine the level of risk in your community." Now, the question is this. Considering that to date Parkland Health did not produce any evidence of a noticeable disease report that would justify an enteric investigation, that Parkland Health has received, to our knowledge, no complaints against any members of the Belbutte community suggesting that there may have been offenses against the Public Health Act or indications that there might be the existence of a serious public health threat in the Belbutte community, is Peter Ross and the Prince Albert Public Health Region in the legal position to force residences of this community to submit to a public health inspection?